My name is Josiah Northern. I'm a firefighter paramedic with the Castle Rock Fire and Rescue Department. Today we're going to be going over the scenario of cardiac arrest management with an AED with bystander CPR already in progress. First and foremost, you want to verbalize body substance isolation precautions. You can also wear gloves and eye protection into this scenario. As you walk into the scene, you want to make sure and ask as many questions as you can and gather as much information as possible from bystanders on the scene. As you get your AED out, you'll power it on and it'll tell you to connect the electrodes, and there's pictures on where to put the pads.
Connect electrodes. Stand clear.
The AED will prompt you to stand clear of the patient, and not only do you need to verbalize this for scenario, you need to make sure bystanders aren't touching the patient as well. Before you deliver any shock to patients, you want to also make sure that you and bystanders are clear of the patient before delivering any shock.
Analyzing now. Stand clear. Shock advised. Stand clear. Push to shock.
After you deliver the shock, you want to make sure that either your partner or bystanders continue CPR for 2 minutes. While your partner or bystander is doing CPR for 2 minutes, you're going to be charged of managing the patient's airway. You want to make sure and open the airway. You want to use a simple adjunct. You can use an OPA or an NPA. Either one's fine. We want to create the proper seal, and we want to ventilate our patient effectively, looking for good chest rise and fall. We also want to be oxygenating our patient, so you're going to want to hook up oxygen to your bag valve mask. Along with good airway management, you're also going to be in charge of making sure your partner and or the bystanders are doing adequate CPR, which means the appropriate rate and depth. After 2 minutes, you'll clear everyone again off the patient and you'll reanalyze using your AED.
Stand clear. Analyzing now. Stand clear. Shock advised. Stand clear. Push to shock.
Again, to reiterate, before you analyze or shock a patient, you want to make sure yourself and bystanders are clear of the patient. After the second shock delivery, you want to instruct your partner or bystanders to continue another 2 minutes of CPR, and you want to verbalize the necessity for transporting the patient. And this concludes this scenario.